A few moments later.
So when you start talking about falls and fall prevention, you see pieces of legislation moving through Congress right now. One is going to fund in-home health care and focus on health care and those healthcare workers. There are not enough of us millennials and Gen Zers to take care of you guys. That's why you're seeing a lot of these nursing homes, these long-term memory care units, these continuing care, retirement communities. You're seeing a lot of these pop up. The families just aren't taking care of the loved ones anymore. They're putting that off. And some people, like in my case, my grandfather wanted to do that. He wanted to do that and be in that community. So that can be the case too. But when it comes to healthcare costs, we're looking at 2016, there were $50 billion attributed to fall-related injuries. I didn't see another number, and I am in research every day. I am in the internet, on my computer every day. The latest number came out last year, and that number was around 101 and 100 to 101 billion dollars related to fall injuries in seniors, and Medicare and Medicaid still bore 2/3 of those costs. There's 10,000 Americans turning 65 every day, so we have to do something. Programs like Balance University is in line to receive funding from another piece of legislation that is pushing through. When all this is going to get done, who knows? But the thing is it's there and it's bipartisan, so fingers crossed. We need that, okay? Also, the final piece of legislation is going to allow physical therapists and physicians to do balance assessments when you guys go to take your annual Medicare checkups, which is going to be excellent because as attached to that, like I just mentioned earlier, that package, that policy is also looking to partner with local programs like Balance University, local fall prevention programs that these doctors, these physicians, these therapists can refer to, which is fantastic. So, does anyone want to guess what health expenditures cost in 1970 versus now? How much do you think the percentage increase is in that number from healthcare costs in 1970 to healthcare costs to today? Does anyone want to guess a percentage how much that's increased?
500%.
Much higher.
Higher.
Higher. 6,600% is how much it's increased since 1970. Right. Well, not to harp on it, 2 years ago, the Wall Street Journal published an article that millennials make 20% less now than what their grandfathers did. So let that sink in. In 1970, we had a total health expenditures go from 74.1 billion in 1970 to 4.9 trillion in 2023. So that's 74 billion in 1970 to 4.9 trillion in 2023. So by 2000, this figure rose to about 1.4 trillion, and by 2023, it's where it's at now. So you're looking at per capita costs. 2023, the average health expenditure per person is around $14,570. What can we do to bring this down? Well, exactly what we're doing right here in class, right? This is a fitness class targeted at your balance. And you guys are on the forefront here. You're on the frontier. Your job here, my job here is to keep you strong, mobile, and independent for the rest of your life, all right? And with that being said, let's take some assessments. Let's see how you are, okay? Let's stand. Let's go behind our chair. Let's rock and roll.